Hey, welcome to this channel, Bipolar Brilliance. This channel is 1 month old today, technically November 1st, and it's been kind of ramble. That was my Freudian slip for sure. It's been random and kind of rambly, and it is what it is, and it ain't what it ain't. But here's something that's really important. Medicare for all, okay? I'm here to talk about mental health, and there is certainly a business aspect to some of the things as far as coaching, but and so people say you should keep your politics out of your profession. You don't want to alienate your audience, and I'm not gonna directly talk about politics, but as somebody with bipolar disorder who was officially disabled by it at one point in time, that's me I'm talking about. I feel like I need to use that voice, because honestly there's been shame with it for me. And yet, you could go to my LinkedIn profile. It's not like I'm some super fancy, impressive whatever, but I earned a lot of letters after my name. I have accomplished a lot of things, and I've, most importantly, I think I've attained a level of stability and happiness and built a little family. But here's the thing. If I hadn't had Social Security and Medicare, and also for a time Medicaid, I don't even know where or how I would be right now. I would not, I will say one, I don't even know. I don't know what I would have done without that. And, there's just so much of a stereotype about people that are on disability, people that are on any kind of public assistance, food stamps, Medicaid. And yet it's like, I don't know. I mean, just like, I try to take everything on a case-by-case basis, take people on a case-by-case basis. And so I can only speak about my own experience and say that, I started working as soon as somebody would give me a job. I mean, I didn't do a paper route. I guess technically I could have started a paper route when I was 10 or something. But I was 13 or 14, and I found out, I knew someone that was like, I wanted to work, and my parents were like, you got the rest of your life to work. Don't worry about getting a job. But I wanted to have my own money. I was weird teenager like that. I guess I didn't really like to just take money from my parents. I made up for it. Okay, but anyway, because they've helped me out a lot. Like really recently. But anyway, point being that I worked, and and this is not to brag, but just to demonstrate that, when I was in my early 20s, I had the job that in my town was like, this is the place. And I was making more money than my mother at one point in time, and even had a bigger home than my parents that I owned with, my partner at the time. And so I was doing very well and I worked and I earned and I earned. And I don't know, circumstances, the interaction of my genetics and my life choices and my environment. I had a breakdown, mania, whatever. At 28 years old, I was diagnosed with bipolar disorder. And I lost 3 jobs in a very short period of time. One of them, I didn't even remember quitting, really. When I went back to get the job, I was like, no, you quit. I'm like, oh, I thought I just cut down my hours, because I was like in this manic state still, that I wasn't making good decisions. And then 2 other jobs in short order, and one of them I lost when I was hospitalized. So it came back and they were like, yeah, we're letting you go due to absenteeism. I'm like, dude, I was fucking in the psych ward. Really? Is this legal? So anyway, so I submitted the application for Social Security disability. I had never had, I went some years without even having any health insurance in my early 20s, because I never had any health problems. And then when I did have insurance, I didn't have prescription coverage, because I never took meds. And so when I got sick, my parents took me in, but then I tapped them out very quickly, because it was like we didn't have coverage for any of this stuff. And this was before, it was just before Obama, before the Affordable Care Act. So it was a lot of things that were different, And I remember at the time I had a friend who had the pre-existing condition of mental illness and was trying to get insurance for themselves and could not get it. So I'm going into a lot of layers, but the point being, it's just we need these social safety nets. I relied on all of them. And thank God I had my family, but if I didn't have that, I might have landed in the streets. And, one of the things that got me started about thinking about all this is with this time right now, we have this health crisis and this economic crisis, and you can't separate the two. And things have been scary here in my home, and I live up north, and I got this hat and scarf and hoodie and fuzzy pants. I was cold 20 minutes ago, and I turned my heat up 2 degrees, but it's freezing outside, and we got these drafty windows, but I am so grateful that I have a home, and that I can turn the heat up to 69 degrees for an hour or 2 or whatever, and that I know that we aren't gonna starve, we're not gonna lose this house, that we have the support. That is one of the reasons why, even when I was really, really struggling and I was too disabled to work, and I was too disabled to even process my application for Social Security, so there was a gap in that. And I certainly didn't process any kind of application for Medicaid or Medicare. I definitely would have been eligible for food stamps, and there's nothing at all wrong with that, but my closest kin said, no, we will make sure you are fed. And we have close kin that are closely associated with our home. I try not to give too much personal, like other people's business, but just, and so it's like, it's a relief. And of course I do, have a strong faith. Faith doesn't have to mean God or whatever on earth you would want to try to describe something that couldn't be named anyway, but like just even knowing that like everything works out. But that's been my experience. Maybe it's just my fighting spirit, my tenacity. But I've been through the ringer, and yet I know I have a lot to be grateful for. But now I'm getting all over my rambling. But if I hadn't had that Social Security disability, which I was, because I worked so much, I got, the most that you could get, because I that's based on your previous income. I put myself back through school. I completed finally my bachelor's degree, and then did got admitted to a doctoral level medical program, which I did for a while and ended up deciding it wasn't the right fit. I'm not a doctor. I say in all my videos, I just speak from my own experience. And then completed a master's degree and a bunch of other letters and certs along the way. And I was like, I had that SSDI for, I don't know, how many years? How many years did I have it for? 5, 6. And then the last time I was up for renewal, I was doing really well. And I said, you know what? Don't even bother. Like, I'm not going to try to prove that I'm disabled, because I'm not. I'm doing very well. And I relied on the community mental health to get free medications. I would go in there every month, and they would give me pills. They would give me a shot, because of public funds. That because I didn't have anything, I didn't have any income, I didn't have any insurance, that I was able to get my meds to help me stabilize and to help me finish these degrees and get work and give back, and giving back. So, when my stimulus check came, I did give, to a lot of causes that I believed in. I'm a big fan of the 8 billion trees, and giving to people that are, people that I, in my family, gifts or, whatever. Just, I probably could learn the balance a little better. But, when everything dries up, so right now, I guess this is what I'm giving, is my word, my experience, strength, and hope, my esh, as some people will call it. There's nothing to be ashamed of from having relied on these things. And I also want to say that even though I haven't had Medicaid for multiple years, I have Medicare, and when I was still having the SSDI, Social Security Disability Income, I received the Medicare, which I think is the best insurance that you can get. Just straight Medicare. It's like you can just go to a doctor. You don't have to deal with referrals. Like, I mean, I'm not saying it's perfect, because, like, let's say, for example, you give birth, like, everything is covered for you, but, like, nothing for your child. So that was a thing I had to deal with when I ended up spending a week in the hospital with traumatic labor and delivery, which ended in like NICU and everything else. Definitely not what I was planning for, but that's another issue. And but things worked out there too. And I'm almost done paying that off. Anyway, talking a lot about money. Must be the Scorpio influence. And I'm sure it's on a lot of people's minds right now, the money or the lack thereof. But anyway, so once the SSDI went away, I was like, oh my God, am I going to lose my insurance, right? Because I didn't, I was still in school, like, because of the way shit is, excuse my French, here in the United States, your insurance is attached to your job. There are other places where they have a little bit more, a better system. Like, people change jobs all the time. And that's another reason I didn't have insurance in most of my 20s, because I was a contractor. So I would have had to buy my own. And, so anyway. So I got on the phone and I definitely took notes. And they said you can pay for Medicare for at least, like, basically 9 years after you lose your SSDI. So, it's been like 3 or so years. So that clock is slowly ticking away. So I say we got about 4 to 6 years to pass Medicare for all, if nothing else for my own selfish reasons, but really for everyone, because I wish that everybody were able to have insurance that is that, like, straightforward. It's very affordable. My premium is like $144 a month. Yeah, it's gone up, but it's the same for everyone. I mean, I could just go on and on. Like, I gave birth at one of the best hospitals around, and yeah, it was kind of weird talking on the phone with someone at Medicare, because when I was trying to figure out if certain things were covered or not, like, a breast pump isn't covered unless it's like medically necessary, and they have these stupid criteria for that. So, there's little things like that, and the woman on the phone was just so confused, like, wait, you're pregnant? Like, how, like, isn't Medicare just for old people? And I'm like thinking, like, do you even know your population? Like, and if somebody is like disabled, it's not just the elderly, it's people with disabilities. If you have Medicaid for a certain number of years, then you become eligible for Medicare or something like that. It might just be that. Don't quote me on this, I'm sorry. Talk to your case manager if you have one, or good luck getting through with someone with Health and Human Services. But anyway, oy. But I actually have had really, really good experience working with people at Medicare and also Social Security, which says a lot as well, because you can tell a lot about an organization, HHS, when anytime you talk to someone, it sounds like they hate life. Just saying. Man, I was like thinking that maybe I should rename this channel Rosie's Ramble. If you were to break my name down, Rosemary Bach Lowry, although I spell Rosemary as one word. If you were to do RMBL, Ramble, but as it is, it's more like RBL, which is Rebel, and that also fits quite a bit because I'm super outspoken, and I don't know. This might sound like some really far off crazy thing, but then again, given the history of our country, maybe not. Maybe I'll run for office someday when I'm like 80. Don't hold your breath. Okay. Well, did this have a point? Yeah, I think it had a point. Definitely appreciate if you have made it this far in the video. For sure, I need to work on being more succinct and to the point. But then you don't get all the juicy little details and layers of the onion. So there you go. I need to love myself, and you need to love yourself. And so I do, and I'm grateful, and I do love this life. And I love, as cheesy as maybe it sounds, I love this country. And no matter who you are going to vote for, do vote early and often. I've got my ballot done, and I am going to hand deliver it into the city clerk's box. Definitely in time to be counted. That's what I know I can count on. So I hope you do the same. Take care of yourselves and each other. Be well and stay brilliant.